Good morning, and thank you for joining me this morning. As usual this weekend, the Royal Exhibition Building is open for vaccinations, both bookings and they're available, or walk-ins, and we encourage anyone who hasn't received their first, second or third dose to come along today. Beautiful day for it. Grab yourself a coffee and enjoy the sun in the gardens when you've had your jab. Every dose matters, and of course we've got those children's bookings available as well, so come on down or to your local vaccination site closest to you. In terms of vaccinations, we've had 43.8% of Victorians 18 and over who've now had 3 doses, and that's a really big jump. At last Saturday, this time last week, we're at 37%. 17,381 doses were delivered yesterday at our state sites, and of course then we've got our GP and pharmacy sites and doses on top of that number. In just the first 2 days since they were made eligible, 4,318 16 and 17-year-olds got their third dose, and I thank all of those who did so, and another 2,300 16 and 17-year-olds are booked into a site in our state-run system to get their third dose. In terms of 5 to 11-year-olds, we had 1,399 yesterday who received a vaccination, and that brings our total to 43,552 for the last 7 days. In total, 278,000 children aged 5 to 11 have received their first dose to date, and that's 48.1% of that age group, up from 40% this time last week. So we've reached over half of the children in Victoria in just 26 days, and that's amazing. I thank those kids, I thank their parents. Everyone should be really proud of reaching half the children in that eligible age group in under a month. That's a terrific result, and we encourage the other half to make those bookings or walk in and come forward. This weekend we do have more primary school pop-ups, and we have 15 total around the state, 5 in regional Victoria and 10 in Metro, and a couple of those include Moomba Park Primary School in Fawkner, Tarneet P9 College, and Roslyn Primary School in Belmont, Geelong. So again, we really encourage all families, age 5 to 11, the 16 to 17 third doses, and any adults who haven't come out yet to come forward and get vaccinated this weekend. With respect to people who are confirmed cases, we have 687 people in hospital. That is our lowest number since January 7th, so it's a really pleasing trend, and we do hope and expect that to continue. Same day last week was 953 hospitalisations, so our 7-day average is now 834. It's a great trend, those figures are coming down, and we have 80 people in ICU, both active and cleared cases. Busy part of Melbourne. So that's 80 people in ICU, 114 last Saturday. So again, our ICU numbers are coming down, but our ventilated patients are relatively stable. We still have 31 on a ventilator. Sadly, today we are reporting 41 deaths that were notified to the department yesterday, and again we send our thoughts to those people's friends, families and loved ones. In terms of case numbers, 5,099 people reported their positive rapid antigen test yesterday, and we received positive PCR results for 2,711 people out of 22,096 tests processed. Currently 63,400 active cases. Again, a really pleasing trend. We had almost 80,000 active cases same time last week, so we do believe that we have reached our peak of Omicron. In terms of who those new positive cases are, again we're seeing an increase in school-aged people. This isn't unexpected. We did see an increasing number, of course, during term 4, term 1 is back. I'm really pleased that the Department of Education and the Department of Health have worked really closely together over the school holidays, and that's being managed really well. There aren't any closed schools at this point in time. The rat surveillance program in schools, that twice a week test, is working really well, and we do encourage parents and children to continue on with that surveillance testing. Whilst we are going to see those positive cases through that surveillance does mean we're going to keep the number as low as we possibly can to avoid additional spreading events in the school setting. And again, there's no shortage of appointments available for people aged 12 and over. There's 268,000 bookings in the system, and for kids aged 5 to 11, 85,500 appointments in the system. So again, vaccination is another way that we're going to be able to keep those school age numbers lower, as well as the surveillance system. And in our testing network, we have seen a significant improvement in our turnaround times, with 97.4% tests return next day. So that's a terrific result. And again, our thanks to everyone in the pathology and testing system for working really hard over the past couple of months and keeping that network going. The average wait time at our testing sites is about 5 minutes. So if you haven't been able to get your hands on a rapid antigen test, or maybe you don't have symptoms and so you really want that sort of gold standard test, please head down to the PCR testing site closest to you, and you'll be able to have that peace of mind. And distribution of rapid antigen tests is continuing, and those can be picked up at certain sites around our network. That's all I have to say, so I'll take some questions if you have them.
Kate, can you talk to us a little bit about what we're seeing in terms of the trend coming down with hospitalisations, but then sadly we've seen the number of deaths increase?
Yeah, so what I will point out is the death number today, it's the notifications to the department yesterday. So it wasn't 41 people who sadly passed away yesterday. Apologies all. So it wasn't 41 people who sadly lost their lives yesterday, but we received notification. Sometimes there can be lag, so that may cover a period of weeks. If there's a late registration with the Victorian Death Index, with births, deaths and marriages, for instance, or if there's a coroner's investigation in some deaths, of course, or if the diagnosis is made post-mortem. So we don't always get that death notification within 1 or 2 days. So the 41 is a really sad, tragic high number, but it doesn't necessarily easily correlate to the number of people currently hospitalised.
And in terms of COVID deaths, are we still seeing a higher number of people who are unvaccinated, or it's a situation that they had comorbidities?
Look, I won't get into individual reasons, of course. Sometimes there's comorbidities. Yes, again, we are seeing higher numbers in ICU, for instance, who are unvaccinated, but it can be a range of reasons.
Sorry, so just in terms of those death numbers and the way they're reported, just with a number in Victoria is quite high. So are we seeing more of those delays in reporting?
This has been a feature, if I can use that word, of our death notifications for the last 2 years. So it's the trend hasn't changed, if I can call it that. Unfortunately, sometimes there can be notification delays for whatever reason, like I just went through. Unfortunately, it was a particularly high number yesterday, and that's very sad. And we do send our condolences to the loved ones of those people who've passed away. But nothing has changed. The system remains the same, and as soon as the department is notified, we report that figure.
So then it sounds like, in terms of, as you say, nothing has changed. So it's kind of like the number is kind of indicative. So it's still quite a large number.
That's right.
Can you explain a bit why that is?
Well, I mean, we have just come down off our highest case load that we've seen throughout the course of the pandemic. So it's not unexpected that our deaths will increase just because we've seen higher case numbers. It's very sad, but again, the more people who contract COVID, unfortunately, we will see a higher fatality rate.
And are you expecting hospitalisations to continue to
fall, or are we waiting to see what happens in this sort of 2-week period after schools have gone back?
I would expect hospitalisations to continue to fall. As we say, there will be probably some higher case numbers or stable case numbers for a while. Schools have gone back. Victorians have somewhat, isolated themselves over the last couple of months. But now more people back to childcare, more people back to school. Melbourne is certainly a more buzzing place than it was a couple of months ago. So we'll just watch the case numbers closely, and of course support our health system to be able to manage their workforce and their hospitalisation numbers.
With that, just on that prediction of them continuing to fall, some surgeons are saying then still why we have this 50% cap for the return of elective surgery.
Unfortunately, that's not something I can really get into. I'm on the COVID response. A big question for the Minister.
The case numbers today under 8,000. Why do you think it's dipped that low?
Well, we think passed the peak of our Omicron wave. I think 8,000 is about where we'd expected. It's all in line with the modelling, and we'll just continue to see how the case numbers go in the next couple of weeks.
In terms of modelling, what are you expecting to see in terms of daily case numbers with the return to school, return to childcare?
It's a bit too early to say. We'd expect fairly stable numbers, or perhaps again, cases dropping. But certainly, as I say, the proportion of cases in that under 19 group has risen over the past week.
Just on that issue that you mentioned about people, I guess, taking it upon themselves to do less. When do you think you will see people going back to the office in the city?
Well, at the moment we do still have a strong recommendation to work from home. That has been the Chief Health Officer's advice to the Minister, and that's certainly where we're at today. I'm sure Brett will look at everything and look at all the data and the evidence, how hospitalisations are going, how mobility data is tracking before he makes any other recommendation to the Minister, and then that'll be up to the Minister to decide.
On that point, though, we've seen people gather in large crowds at the tennis and at restaurants. Do you think it makes sense for the government to not make people head back to the office at this point, given that they are generally more regulated environments?
Look, I take Brett's recommendations. He's the professional in this area. He's certainly very, very well experienced to make those recommendations to the government. So I think, given that's his advice, I think it's the right thing to be doing.
Do you know approximately when we might hear from him?
No, I don't know.
Is it about the office buildings themselves or about the mobility around it?
Well, I mean, obviously anyone gathering together in any space leads to the possibility of transmission. We're also aware that many people don't like wearing a mask indoors in the office for 8 or 10 hours, but unfortunately masks, we've all learned this over the last couple of years, masks are one of the best ways that we can keep ourselves safe. All the usual COVID safe behaviours, social distancing, masks, hand sanitisation, hand hygiene, all those getting tested when you have symptoms, isolating if you have symptoms. We're all pretty experienced at this now, so I do understand why people may not want to gather in an office and wear a mask for 8 or 10 hours, but it's certainly one of the safest things we can do.
Should people really be thinking now about wearing masks for the long term? Because it looks like it's going to be sticking around, so should they be getting used to perhaps going to the office with a mask?
Again, it's probably a question for Brett, but I don't see masks going anywhere anytime soon. It's one of the most effective and easiest mitigations we have against spread of COVID.
Short and sweet.
Excellent. Thank you all.
Happy with that.
Thanks.
Have a good weekend, guys.
You too.
You too.
Thank you.
Thank you. See ya.